We'd like to get started. We have a very busy agenda, and we want to be respectful of our president's time here. My name is Toni Villarrue, and I'm the chair of the IOM Roundtable on the Promotion of Health Equity and the Elimination of Health Disparities from the Institute of Medicine. The purpose of our roundtable is to promote health equity and eliminate disparities by advancing the visibility and the understanding of the inequities in health and in healthcare among racial and ethnic populations, to amplify research, policy, and community-centered programs, and to catalyze the emergence of new leaders, partners, and stakeholders. I'd like to take this opportunity to introduce members of the roundtable. First, our co-chair, Mildred Thompson from Policy Link, who I know is no stranger to the Detroit area. And then I'd like the other members of the roundtable to please stand up so people know who you are. In particular, I'd like to mention Dr. Rose Martinez, who is the director of the Board of Population Health, of which this roundtable reports to. Dr. Karen Anderson, who has been our staff and logistical support, and Colin Fink, who you see behind. The purpose of our workshop today is to discuss the opportunities to use digital health technologies as a population health strategy to reduce health disparities and promote health equity in the U.S. We're looking to explore specifically how minority populations and communities can be engaged in efforts that utilize these strategies to reduce racial and ethnic disparities. And we also want to highlight examples of digital health strategies that we know are already in place. I'd like to acknowledge the planning committee for this workshop, and that's Dr. Gillian Barclay, who you'll meet in a minute, Carolyn McKay, Dr. Rohit Varmut, and Karen Anderson, and of course, Colin Fink. So now it gives me my great pleasure to introduce to you President Roy Wilson, and to publicly acknowledge the support that he has provided for us in getting this roundtable up and moving, all the logistical support, and welcoming us here to this campus. I have to tell you that I'm a proud alum of Wayne State University. I received my PhD here a while ago, and also worked down the road at Children's Hospital of Michigan, enough years to get retirement from, so it's good to be back home. So President Roy Wilson is a newbie also. He celebrated his first year in August of 2013. Prior to Wayne State, Dr. Wilson, no stranger to health disparities, served as Deputy Director for Strategic Scientific Planning and Program Coordination at the National Institute of Minority Health and Health Disparities at NIH, where he led the development and implementation of an integrated system for planning, coordinating, and evaluating the NIH Health Disparities Research Portfolio. He was also co-chair of the NIH Common Fund and the National Research Mentoring Network. Previous to coming to Wayne State, Dr. Wilson was Dean of the School of Medicine and Vice President for Health Sciences at Creighton University and President of the Texas Tech University Health Sciences Center, and while he was concurrently Chancellor of the University of Colorado Denver and the Board of Directors of the University of Colorado Hospital. Immediately prior to joining NIH, Dr. Wilson chaired the Board of Directors of the Charles Drew University of Medicine and Science. I know that we all feel very fortunate that we were able to attract such a superstar here to Detroit. Dr. Wilson is also a distinguished researcher and ophthalmologist. His research has focused on glaucoma and blindness in populations from Caribbean to West Africa, and he has many honors, including membership in the Institute of Medicine. So, Dr. Wilson.
Well, thank you very much, Toni. Welcome, everybody. It's such a pleasure to welcome you here, particularly since I know so many of you. So I think that you've picked a great place to have your meeting, particularly any group that's interested in health disparities. You know, we're not really proud of this fact, but the reality is that Detroit is one of the health disparity cities in not only the country, but in the world. I think that you know that we have here at Wayne State the perinatal research branch of the NIH. This is the only research center, NIH research and clinical center, that is based outside of Bethesda. And the reason why it's here is because of the health disparity population here. You know, infant mortality and preterm birth, as an example, there's a greater disparity here than perhaps anywhere, well, certainly anywhere in the country, but it equals the worst in any place in the world in terms of infant mortality. So this is an area with tremendous problems related to health disparities. I know that your topic today is digital health technologies to reduce health disparities, and Wayne State, being where it's located, is certainly involved with a lot of health disparities research, but also specifically research related to digital health technologies. For example, in our family medicine and population sciences, in combination with our Kamanos Cancer Institute, they're looking at survivors of cancer who have access and who do not have access to internet, and looking at determinants of clinical and healthcare related factors that's relevant to that survivorship, as well as social structural determinants of access. Also in our emergency room, we have an investigator that's looking at the impact of message reminders by texting on medication adherence and blood pressure. And then a particularly exciting one, I think, is an interdisciplinary team has developed a field test sensor to assess cardiovascular stress. This sensor includes a heart monitor which communicates with the Bluetooth. And that Bluetooth communicates to a smartphone, and the team can identify whenever the heart rate increases, and that triggers a central sensor, which then gives messages, specific messages to the patient in terms of questions and everything that the patient then answers. And so the team can actually monitor what's going on in this very high stress population that we serve. And so those are just examples of some of the technologies that we're experimenting with here at Wayne State. The other reason why it's such a great place to have a meeting is Detroit itself. There's a lot of things going on in Detroit. I know that since you're staying downtown that you witnessed one of those things, which is the traffic is not the easiest to get around these days because of Woodward being totally torn up, but that's a sign of progress. We're having an M1 rail come all the way from downtown to through Midtown here, which is going to be tremendous for us. You know, Woodward is a huge, wide street, and the three auto companies, there used to be a rail on it, but the three auto companies wanted people to drive more, and so the rail was taken out many years ago. And so this is, I think, a sign of progress that we're putting the M1 rail back in so that we can have much better public transportation. But also in terms of what's happening downtown and Midtown, particularly Midtown, you know, you're in such close proximity to the main Wayne State campus. I don't know your schedule, but you know, hope you get a chance to go by there. It's actually within walking distance. The Detroit Institute of Art, which I'm sure you've heard about as part of the Grand Bargain here in Detroit, is certainly within walking distance. As well as one of the things that we like to brag about is the Shinola watch factory, which everybody here in Detroit, from the governor to the mayor to everybody, is always proud to sport a Shinola watch, which I don't get paid for that. It's just that we're just very proud of the things that are made in Detroit, including a little startup company that makes colorful socks and stuff. So, so we're very, very proud of everything that's going on here in Detroit. And if there's any assistance that I can provide you during your time here, please do let me know. If you need transportation or you know, any recommendations for anything, please do let me know. And I'm sure that one of my staff people will be more than happy to accommodate you. So again, thank you very much for having your meeting here. I wish you a very productive day.
Thank you, Dr. Wilson, and thank you again for all the support that you've provided for us.